In this video, we're going to discuss diabetes and its effect on macrovascular disease. Basically, macrovascular disease is a condition where the large blood vessels of the body are compromised. Some of these large compromised blood vessels are blood vessels in the brain, which lead to cerebrovascular disease, large blood vessels of the feet, which lead to peripheral vascular disease, and you can also have cardiovascular disease. The thing about diabetes is that it causes other conditions to become parallel with it. So in the fact that you have high levels of blood sugar in the body, you can also get hypertension. Although we're mainly focusing on diabetes, it's imperative that we control the blood plasma glucose levels in the body. So basically, to define diabetes is where the body has an inability to produce insulin, or if insulin is produced, it does not use the insulin well. It does not function, it does not know how to get the insulin to function well. Diabetes increases stroke, myocardial infarction, and also causes peripheral vascular disease, and that presents with a lot of claudication and a lot of pain. What is contradictory is that exercise helps decrease the blood plasma glucose levels in the body. So when you exercise, it helps insulin to be shunted into the cells so it can be used. However, because the peripheral vascular disease causes so much claudication and so much pain, it becomes difficult to exercise. With diabetes, you can delay the progression of macrovascular disease by some lifestyle changes. Some of these lifestyle modifications could be simply losing weight if you're obese, exercising at least 20 minutes for a minimum of 5 days a week, selecting whole foods with a low glycemic index that has a benefit on the body. Even foods that are high in antioxidants help decrease the inflammation that comes with diabetes that can cause disease. It is useful that if you have been diagnosed as a diabetic, to use your medication, to be adherent and compliant, to use it as prescribed by your physician. Also, you can enter into structured education programs to see how best you can learn about diabetes and share experiences with your peers. The statistics in Barbados are glaring. Just last year, we had over 365 strokes. That equates to almost a stroke a day. In 83% of these strokes, a blockage to the brain was a result, which demonstrates that a cerebrovascular event occurred. Moreover, 1 in 3 of these stroke patients were diabetic. So we see the parallel again of how diabetes have led to a cerebrovascular event. Yes, there is a genetic component with diabetes. So research have shown that if one parent or both parents had diabetes, the likelihood for the offspring to develop diabetes would be increased. That is for type 2 diabetes. However, for type 1 diabetes, which is an autoimmune disease, the research still shows that there is an increased chance of developing diabetes. Some of the more common foods that Barbadians eat that lead to obesity would be pudding and sauce, macaroni pie, the use of a lot of carbs and starches on our plate. So we have too much starches on our plates. Sometimes we have 3 starches with 1 protein and limited veg. So I would encourage my fellow Barbadians to use whole foods high in antioxidants, low in sugar. I encourage you to read your food labels to see the amount of grams of sugar or amount of carbohydrate that you're consuming before actually using the food. From my experience as a pharmacist, what I've observed, and even more now, is that persons within my age group, the amount of alcohol they're consuming. And research have shown that within the Eastern Caribbean, Barbados consumes the most alcohol per square kilometer, even though we are one of the smallest Caribbean countries. However, this can be attributed to that Barbados was one of the first islands to produce rum, and we are known for our rum. But what I can advise is that if you do consume alcohol, you consume alcohol in moderation. If you can avoid it, please avoid it, because the extra calories that you have not calculated also increases your carbohydrate count, which if then can be stored as glucose, stored as fat, increasing your obesity risk and increasing the chance of developing diabetes. To conclude, I would encourage tight glycemic control, lifestyle change, so that we prevent rather than prevent the progression of macrovascular disease, because these events lead to high mortality rates, and even if they're not fatal, the quality of life is reduced. Thank you for watching this YouTube video.